started to do some outreach into the community at that time. So then we have kind of somewhat a few other organizations that we were working with. And then I think that's when we sat down and we just kind of like talked and say and learn from each other. Okay, what do we do during this time? What program can we come up with? What are the needs? Like, what is our community member need? So at that time, we're pretty much open to anything that was available. We're open to do anything or just whatever that we can do to make the whole experience better for everybody, especially for us because we're a Vietnamese community that serve mainly the seniors. And I think for the seniors, it's even scarier because they're at risk the most.
Share about some of the challenges that the Hispanic community face and how did you help overcoming those challenges during the pandemic?
Yeah, gosh, there were so many challenges. The biggest one was I was fortunate to be part of the Orange County COVID-19 task force. Dr. Chow asked me to be a part of it, and when they started coming out with all these ideas of how they were going to roll out the process for vaccinating the most vulnerable community members, they came up with this app for the community, and the most vulnerable community members were older adults. A lot of them were monolingual, Spanish speakers or Vietnamese speaking community members. And they wanted the community to access an app that was only in English. And they also had limited resources to provide translation when they called in to get an appointment. So although they prioritized the community that was most vulnerable, they really did not provide any access. So our community here is eager to get the vaccine. They're the most impacted. They're the ones that are in the hospital, the ones that were dying. And the response was, go to the app. That's in English only. So we jumped in pretty quickly and said, initially it was a little knock on the door, and then it really was a kick on the door. And it was saying, this is not acceptable. Our mission is to help the most vulnerable.
Share with us a story about the first mobile vaccine clinic.
That really takes me back. So with the whole pandemic for us, it really started early on in 2020. Because of our connections to Asia, we had heard something was going on. People were getting sick. So our seniors actually were the ones that reached out to us and were asking, what should we do? I, in turn, turned to the authorities that we had in Orange County, from our government agencies to our officials, and let them know, hey, there's a mysterious sickness that's happening. People didn't have an answer. We weren't ready. So for us, we just decided, you know what, we'll take this on our own. So we actually reached out to the local hospitals, medical providers, and let them know, hey, do you have masks? Do you have hand sanitizers? These are the things I think that will alleviate some of the concerns our seniors have. And so I would say a good 9 months before, we were gathering all the supplies. Eventually, we also worked with our partners to get food, to get anything that will alleviate some of the stress that our seniors were having because they were isolated.
Yes, hello, my name is Dr. Clayton Chow. I'm the former Orange County Health Agency Director as well as the Health Officer for Orange County during the pandemic.
So how did your agency, so the HCA, how did they work with Hope Community Services to bring the community out of the pandemic?
Go out and vaccinate the senior. And that was good because you got Latinx community CBO, work with the Asian CBO, and we were just all there. We just crossed the border and we serve, right? Our intention is serve the vulnerable. Again, government cannot do it alone. Most community-based organizations didn't have the infrastructure to traditionally go after some funding from the government. But this time, the government, meaning me representing the county, bring resources to the community and said, please help us with the other connection you have with the community, the human resources in terms of volunteer, and then we bring the finance and material resources and come together to serve the community. These CBOs and NPO have created the community. Nothing could buy that. That's so valuable, right? And I remember that there would be flyer from the county say, senior, it's your turn to get the vaccine. Please come to this website. Nobody go, right? But when the CBO, the community CBO, the NPO go to the neighborhood and say, come out and do the neighborhood, they came out and do the neighborhood because they trust our entity. The public side, the government side really need to understand what kind of infrastructure that a CBO and NPO would need to continue their work in the community.
The pandemic was such a difficult time for all of us. In the beginning, we didn't know how to respond. The year 2021, when we were able to connect with the public agency, the healthcare agency, and conducted vaccination clinics, I think after that first clinic, our life completely changed. All of us at Hope and also our partner organization for 6 months, I think we worked every day, just restless, non-stop. I said there is a bigger community out there, that we're not just here working in silo. We actually have so much in common. We share similar value, we share similar challenges, the same challenge that the Vietnamese community or the Catholic community or the Chinese community face is very, very similar to what the Hispanic Latino community face, or also the Black community face. So together, when we united, then we can help all of us, and we didn't say no to anybody. And the public agency can support us with resources, information that CBO don't have, and CBO can be that trusted partner to share those services, to share those resources, so it goes to those that actually need it the most.
We partnered with Abrazar, who then partnered with smaller and emerging grassroots organizations. Together, they were able to reach community members to get folks vaccinated in their communities. The Office of Community Partnerships and Strategic Communications intentionally listened to communities to help us accomplish our goals. When we talk about trust and trusted messengers, we at the state also hope to develop trusted relationships to effectively reach our diverse communities in California.
Beginning, I remember to receive a call from Jennifer and invite me to bring my seniors to her side to do the vaccine. And we also do door by door. We knock the doors and we pass flyers and we make Zoom meetings with them. So where they, okay, you don't want a vaccine? Come to our Zoom meeting class and we can talk more about what is happening if you do not receive a vaccine. At the beginning, we went with them to the site and showed this, you can get the vaccine. Nobody here, no police, nothing. So, and they think that when they pass the voice to their Latino communities, when the undocumented people start coming to the vaccines. Also, they think, oh, I don't have paper, I don't have insurance. And I say, no, it's free. You don't worry, you have to pay nothing. It's free transportation, it's free everything. We will be there for you. And yeah, and they start coming with us for the vaccines.
Share with us a story about the first mobile vaccine clinic.
That really takes me back. So with the whole pandemic for us, it really started early on in 2020. Because of our connections to Asia, we had heard something was going on. People were getting sick. So our seniors actually were the ones that reached out to us and were asking, what should we do? I, in turn, turned to the authorities that we had in Orange County, from our government agencies to our officials, and let them know, hey, there's a mysterious sickness that's happening. People didn't have an answer. We weren't ready. So for us, we just decided, you know what, we'll take this on our own. So we actually reached out to the local hospitals, medical providers, and let them know, hey, do you have masks? Do you have hand sanitizers? These are the things I think that will alleviate some of the concerns our seniors have. And so I would say a good 9 months before, we were gathering all the supplies. Eventually, we also worked with our partners to get food, to get anything that will alleviate some of the stress that our seniors were having because they were isolated.
Can you share a little bit more about some of the projects under EIOC?
So some of the projects under EIOC that was connected to what we were learning and witnessing during the pandemic, we continue the legacy of some of the collaboratives that was happening or that came as a result of the pandemic. And so we funded a lot of 7 population health equity collectives. So these are collaboratives that addresses a certain community. So we funded the Asian Pacific Islander Collective, we funded the Black Collective, Individuals with Disability Collective.
How did you come into some of these funding decisions? Who or what projects were important to the community?
We just really recognized very early on, looking at data and looking at and hearing from the community, which are the most impacted populations. And so we recognized early on that the Black community, Latino community, LGBTQ community, API community, individuals with disability, and the Samina community, the South Asian, Middle Eastern, and North African community were most impacted by COVID-19, right? And so we wanted to continue to foster that relationship and that collaborative spirit, at the same time give them opportunity to build their infrastructure so that we can better attend to future crises.
So what were some outcomes that you were very proud of, and also what were some lessons learned after 2 years implementing EIOC?
So some of the lessons learned after implementing EIOC for the last 2 years, one is that this work is very challenging, both on the political side of things, from politicians, electeds, but also from a politics side of things within community, right? And I think oftentimes those in power have created a structure where community have to fight for crumbs, right? And so that's as a result of the system. But it has conditioned community-based organization to function and interact with each other in certain ways. And so unlearning some of those conditions and unlearning some of those behaviors have been, I think, a challenge. Another challenge is that how do we make sure that the work of health equity is not because it's popular right now, or it's not because it's a requirement from the state or from the federal government, but we're doing it because we recognize that if we don't do it, our communities are going to suffer and die as a result, right? And so how do we do it? Because it's a value, right? And it's a moral and ethical conviction rather than it's a requirement, right? And it's a checkbox. And I think oftentimes at the current state, it's a lot of checkboxing, and our community deserves more than that.